During the 1930s, there was a desperate health message that was tragically lost. It all began with a dentist named Weston A. Price, who was a Canadian that practiced in Cleveland, Ohio. He was concerned that the patients he saw in his practice had declining oral health, and it was connected to their diet. His suspicion set him off on a research project that would see him visit societies all over the world. It would also begin a 70-year mystery that has only recently been solved. Price's work captured a fleeting snapshot in time that looked at the interface between the modern diet and where traditional societies live with food practices that have been a part of their culture for thousands and thousands of years. What he found was that they had spectacular straight teeth with wide jaws and nearly no tooth decay. He compared what happened to them when they began to introduce the modern diet and eat the foods that we eat today. It was then the crooked dental arches and cavities shot to the rates that we see them today. Price's method was to analyse the dental health and the diet and anthropological history of the societies he visited. His findings showed that every society shared one thing in common. The foods they considered sacred and crucial were rich in the fat-soluble vitamins A and D. He thought that these two parts of the diet were crucial for building blocks of the stunning dental health that he exhibited. But there was a mysterious third factor in the foods that these societies would eat. Price would call it Activator X. His death in 1948 would mean he would never find out what it was. Activator X was actually vitamin K2. Vitamin K2 will go down in history as the most underappreciated nutrient ever. It's a fat-soluble vitamin which is closely related to vitamin K1. We know vitamin K1 is crucial for blood clotting, and for most of the 20th century, that's all we thought the vitamin K2 did. But K2 is a similar yet different set of molecules. It's a fat-soluble vitamin, and like A and D, it works to build strong bones and teeth. See, K2 activates proteins that carries calcium out of your soft tissues and into the bones and teeth. Without it, your body cannot manage calcium in your body. Vitamin A, vitamin D, and vitamin K2 work in a sacred trilogy to give us a strong skeletal system. The misunderstanding of Price's work means we've ignored the dietary role of growing straight, healthy teeth and bones. Today we know the physiology of vitamin K2, and it's time to start building our nutritional guidelines around dental health. In the dental diet, we'll join Price's work with the modern scientific research and physiology to show how your food is crucial for the human jaw and teeth.